In this instructional video, we will cover how to properly set up and drape the WalterLorenz surgical assist arm. The non-sterile person will affix the rotating table rail clamp in position for the procedure. Snap the clamp on the table rail at the desired location, coming from the top of the rail with the Zimmer Biomet logo facing up. The non-sterile person slides the pole into the rotating table rail clamp. Then turn the table rail clamp handle clockwise, ensure the pole is perpendicular to the floor, and rotate the table rail clamp if necessary. The proximal arm and user interface keypad should be directed away from the table for draping. After selecting the appropriate length of distal arm, align the threads to those on the proximal arm. Screw the collar on in a clockwise motion until it stops and there is no visual gap between the distal arm and the proximal arm. The non-sterile person should now power on the device by depressing the power button on the user interface keypad for 1 full second. The non-sterile person should now use the unlock button on the user interface keypad to position the arm. It is recommended that the sterile person be wearing 2 sets of sterile gloves at this step. The sterile person will connect the end effector to the distal arm by inserting the taper into the distal arm receptacle and rotating the collar clockwise to screw the end effector on until fully tightened. The sterile person will remove their outer set of gloves. The non-sterile person transfers the distal unlock button to the sterile person in an aseptic manner. The sterile person inserts the plastic tip of the distal unlock button into the end effector and presses it down until it snaps in place. The sterile person then drops the remaining unlock button cable into the hands of the non-sterile person. Next, the non-sterile person will insert the distal unlock button cable into the port marked with the unlock button symbol. The non-sterile person will open and present the drape to the sterile person using an aseptic technique. While using 2 hands, open the bottom of the drape to facilitate acceptance of the end effector. Next, gently grip the elasticized seal on either side of the opening and begin to pull down, ensuring the end effector slides through the opening. Continue pulling until the seal edges come to rest in the retention groove on the end effector collar. From here, continue to pull the drape down the length of the device and cover as much of the rotating table rail clamp as possible. Now wrap the rubber bands around the excess portion of the elasticized seal, thus securing it in place. Then proceed to remove the tape from the same area where the rubber bands were located. Next, wrap the tape with the adhesive side to the drape just below the elbow joint on the distal arm. Take caution not to wrap the tape too tightly. Press and hold the distal unlock button, move the device over the patient, then release the button. You are now ready to select the desired direct connect instrument or universal instrument holder, and the device is ready for surgery.